Welcome, class, to our first presentation for ME121, Human Anatomy and Physiology. My name is Angie Bland, and I will be your instructor for our journey throughout the next 10 weeks. I enjoy teaching human anatomy and physiology because it's like the everything about us. It's what makes us and how it all works, and I find it very intriguing, and I hope that you will find this journey as much fun as I find teaching it. I've been in the field of adult education for many years now. I think about 15. I hate to say that because it sounds like a lot. Um, but I've taught online, I've taught on ground, I've been a program director, I've been a clinical coordinator. So I kind of feel like I've come full circle. And I truly enjoy being in the classroom, and I love online learning because I find it a fun adventure to see how we connect without physically being in the same room together. So if you ever have questions for me, definitely shoot them out to me. My biggest thing with online learning is communication is very, very important. And I don't want you to ever feel like you're in this journey by yourself because I am always here to help and support you and to be your biggest fan and to impart as much knowledge as I possibly can during these 10 weeks. Each week, I will record a presentation, and it's very helpful for you to listen to this to help prepare for your quiz, especially. So definitely listen to it each week before you take the quiz. This week, we'll have a few extra things in terms of what to expect, and I think I go through those at the very end of the presentation. Other than that, each week we'll kind of focus in and hone in on the highlights of the material that's going to help you prepare for your quiz. So let's go ahead and dive right into this week's content. For this week, we are looking at two chapters in your textbook. Chapter 1, which is more of an introductory chapter, as well as Chapter 2, which focuses on the human body. If you don't already have your textbook, definitely go ahead and order that. It is Anatomy and Physiology for Health Professions. I believe it's the third edition. And at the end of the presentation, I'll have a reference with that information on it. Otherwise, you can always find your textbook information in the syllabus of the classroom. So what is anatomy and physiology? Let's kind of start there. What is it that we're taking this class for, and why is it important? Overall, science is a way of thinking and a method of investigating the world in a systematic manner. And human anatomy and physiology is considered a science. So anatomy deals with the structure or morphology of the body and its parts. So in other words, it's the name of the parts. There's many specialty fields within anatomy. Some of those include microscopic anatomy or macroscopic anatomy, which is also gross anatomy. Some examples of gross anatomy, if that's a new term for you, taking an MRI of a knee is considered gross anatomy because it's considered large scale. Viewing an x-ray is also considered gross anatomy. Physiology, that is the study of the functions of the parts, or it asks the questions, how do they work? The two disciplines are closely interrelated because the functional role of the part depends on how it's constructed. Our body is a fine-tuned machine and things work well together, and there's a reason for that. And a lot of it has to do with the structure of it. So structure does affect function. So we study the two together. If you are currently taking medical terminology, you'll find these classes go hand in hand. A lot of times in our human anatomy and physiology book, there's many medical terms, and we have to know how to talk the talk or break down those medical terms in order to be successful in this class. So it's great if you're taking the two classes combined. If you've already had medical terminology previously, it's okay. But what we're looking at is, do we really know how to break up the words? Because you're not going to know every medical word that's possibly out there, but you might know the parts of the word and can derive the meaning by breaking it apart. Generally speaking, we talk about word roots, combining vowels, suffixes, and prefixes when we're looking at medical terms and dividing them into the pieces. It's like breaking a puzzle apart. Here are some examples of terms that I would love for you to know for your quiz this week. Hyperglycemia. If we break that word apart and look at the suffix first, emia means blood. Hyper, which is the prefix, means above normal. Glyc means sugar, so hyperglycemia means high blood sugar. Electromyogram. Let's break that one apart. The suffix gram means a recording of or a record of. Electro means electricity. Myo means muscle. So electromyogram means a recording of the electricity or electrical activity of a skeletal muscle. Tachycardia is our last example listed here. The prefix tachy means fast. Card means heart. And that suffix ia means a condition of. So tachycardia means fast heart rate. Another important thing in terms of how we communicate the language of medicine are the use of abbreviations. And now abbreviations I want to caution you on. They can be good and bad. They can be really quick to use, and that's great and handy, but they have to be used responsibly. We have to be using abbreviations that are widely accepted and approved. We can't make up our own abbreviations. We can't use things that other people might misconstrue. It could create a huge problem. So the little cartoon in here focuses on LOL, meaning laugh out loud. Well, in the medical field, that refers to loss of limb in some settings. So you can see how things can be perceived differently. Some examples are listed in your book. You have great table reference guides in your textbook, so definitely utilize that. I know there's a couple that your quiz focuses on. RBC is the abbreviation that's widely accepted for red blood cell. SOB is the abbreviation in the medical field that stands for shortness of breath. Next, we're going to get into body positions. It's important that we all, when we are talking and using medical language, are picturing our patient in the same position. Generally speaking, the most widely accepted position we should picture our patient in is anatomical position. And here we see a gentleman standing in an anatomical position. He's standing upright or erect. His face is forward. His limbs are at his sides, and his palms are facing forward. That's important. There are many other body positions, and your book does a nice job at going through all of those. I'm just going to touch on a few of the most common ones. The supine position, that just means you're laying down on your back. The prone position is where you're laying face down on your stomach. So an example where you might be communicating the prone position, if your patient relates to you that they sleep on their stomach, then you could put or chart that they sleep in a prone position. Some other positions that are common for certain examinations. Trendelenburg position, I know it looks awful. It's where the feet are above the head. That is used, generally speaking, for a patient that might be in shock or very low blood pressure and sometimes abdominal surgeries. The Fowler's position, and here we see a semi-Fowler's position because the head is semi-upright, but it's where the head is higher than the feet. And that is good when a patient's having breathing difficulties and sometimes even lower back pain. Next, we're going to shift gears and go to our directional terms. Directional terms can look a little overwhelming at first. The good thing is they come in pairs. So if you know one of them and you know what its pair is, you can derive the meaning of the other one. So it's kind of cool. The term superior means above another part. Inferior means below another part. Anterior means toward the front of our body. Posterior means toward the back, or one part can be anterior to another part, meaning it's in front of, or posterior to another part, which would indicate that it's behind or in back of. Medial versus lateral. Medial means towards the midline of the body. Lateral is going to mean towards the side or the outside of the body. Proximal versus distal. Proximal is going to be closer to the point of attachment. Distal is going to be further away from the point of attachment. So our shoulder is proximal compared to our fingers. Our fingers are considered distal compared to our shoulder. Your book also goes through superficial versus deep. Superficial, it means it's very towards the surface of the skin. Deep means it's deep within the body. Same thing with ventral and peripheral. An ankle is considered a peripheral structure. It's far away, and central would be more towards our core. The table that I think is super handy for you all, and your book does a nice job. They also, one thing I like about this table is they use the terms in a sentence so you can derive its meaning in a context as well. I'm not going to read through all these, but table 2-1 is a great reference source for you. So definitely use that as a one-stop shop for those directional terms. Planes of the body. At first, when people were talking to me about planes of the body, I was getting really confused. I'm like, what do you mean planes of the body? If we were to slice the body straight down the middle or from head to feet or however, imagine if we were piecing apart the body, such as an MRI or CT would do. It takes sections or slices of the body. That's how we have to picture these planes of the body. The sagittal plane, and on our picture here, it is the blue or kind of the purpley color. It sections or divides the body into right and left portions. If it happens to cross along the exact midline of the body, it's called mid-sagittal. And in that case, the mid-sagittal plane would divide the body into equal right and left portions. So we could divide the body into right and left portions many ways, like a loaf of bread. But if it's exactly down the middle, that's considered mid-sagittal. Transverse. This is a section that divides the body into superior and inferior portions, or the head portion and the feet portion. Coronal, also sometimes called frontal, it divides the body into anterior and posterior sections. So it's going to divide the body into the front of our body and the back of our body. The body consists of right and left halves that are mirror image. So our body is considered to have bilateral symmetry, which is kind of cool. So you have a left hand, you have a right hand. You could divide us down the middle. And if you remember way back to elementary school, lines of symmetry, when you talked about geometry, we could have a line of symmetry on that mid-sagittal plane. Next, we're going to look at cavities of the body. So the dorsal cavity is located in the back of the body and consists of two general cavities, which is the cranial cavity that houses the brain and the spinal cavity or vertebral cavity that houses the spinal cord. There are subcategories within there. Some that you might be familiar with, the oral cavity. Again, it's part of the head, but it's actually the oral cavity is the space within the mouth. The vertebral cavity or the spinal cavity could be further divided into the cervical region, which is the vertebra of the neck, the thoracic region, which is our chest area, the vertebra of our thorax, and the lumbar region, which is our lower back. Sometimes your quiz is going to ask you some application type questions, and I always love those because I find them more interesting. But an example would be if someone was complaining of having difficulty breathing following a car accident, they may have bleeding into which cavity of their body. So if you think of difficulty breathing, that's got to be our lungs, right? Well, the cavity of our body that deals with the lungs or houses the lungs would be the thoracic cavity. So that's what we're looking for in that type of application type question. Together, the thoracic cavity and the abdominopelvic cavities make up that ventral cavity. The abdominopelvic cavity consists of the abdominal cavity, which is our organs of digestion as well as the spleen. The pelvic cavity, which that's more of the end of our large intestines, the urinary bladder, and also the internal reproductive organs. There is an important muscle that separates the thoracic and the abdominal pelvic cavities, and that's the diaphragm. The diaphragm is used for breathing. It is a broad, thin muscle. Next, we're going to look more specifically at our abdomen. Our abdomen can be divided in a number of ways to make it easier for us to understand where a patient might be having pain or discomfort or something might be happening. And one of the easiest ways is the quadrants of the abdomen. So if we picture our stomach region divided into a cross with 4 sections, then we can picture the quadrants of the abdomen. So the right upper quadrant is abbreviated RUQ. And you can see on here it lists the organs that would fall into that: the liver, the right kidney, the colon, the pancreas, and the gallbladder. The left upper quadrant, abbreviated LUQ, we also have part of the liver there, the spleen, the left kidney, the stomach, part of the colon, and the pancreas. Our pancreas lies pretty midline. The right lower quadrant, often abbreviated RLQ. Again, we have part of the colon, a majority of the small intestines, ureter, which leads from the kidney to the bladder, and the appendix, which is an important thing to remember for the right lower quadrant. The left lower quadrant, abbreviated LLQ, consists of the colon, the small intestines, and the left ureter. So if a patient was having pain in the right lower quadrant, that could indicate appendicitis. That's kind of an important tip to remember. If a patient is experiencing pain in the liver, that would be pain in the right upper quadrant, generally speaking. We can also further divide our abdominal area into 9 divisions, and this gets a little more specific, which is good because there's a lot going on in our abdomen. So you'll see the divisions on here: the right hypochondriac, the epigastric, the left hypochondriac, the right lumbar, the umbilical, the left lumbar, the right iliac or inguinal, the hypogastric, and the left iliac or inguinal. The belly button is located in that umbilical region. If you think of your umbilical cord, your umbilicus is the name for the belly button. It all kind of starts to come full circle. The liver is generally said to be in the right upper quadrant or the epigastric region. It does kind of go over to that right hypochondriac region as well because the liver is pretty big and broad. There are some terms that we definitely all need to be aware of, and this is just the language of medicine again: signs versus symptoms. Often those can be confused, and people might think they're the same thing, but they're not. So signs are definite, objective, obvious indicators of an illness. Vital signs: your temperature, your pulse, your respirations, your blood pressure, a fever, a cough. Symptoms, these are more subjective and can be difficult to measure consistently. Pain. Different people have different tolerances to pain. Some vital signs are measured using the metric system, so that's important to know, such as the weight of a small infant is generally measured in metric. It'll be measured in grams. Cardiac output is measured in volume, measured in milliliters per 60 seconds, so that is a metric unit. Fever is measured in metric units of mercury. One symptom example that your quiz focuses on, which I found kind of obscure, but we'll throw it in there: sweating at night can be a symptom of tuberculosis. So that's a little tidbit I want you to remember. Next, we'll talk about prognosis versus diagnosis. Again, they might sound similar, 2 different things. Diagnosis is the determination of the nature of cause of injury or disease. To make a diagnosis, you must first determine the patient's chief complaint or the most important thing they're relaying to you. Prognosis is the prediction of the outcome of the disease. So once you make a diagnosis, then you can tell your patient their prognosis. Another term to know is homeostasis. Homeostasis sounds big and confusing. It just means the maintenance of a stable internal environment. Our body doesn't like to be at stress. It likes to maintain even keel, similar to a thermostat in your house. You can set it so that you turn on the air at certain times or you turn on the heat at certain times, but it's best if we maintain a constant temperature, and that's what your body tries to do. Stress activates the homeostatic mechanisms that return the body to its steady state. Homeostatic mechanisms are self-regulated control systems that maintain an appropriate internal body environment. The body uses feedback loops to maintain homeostasis. The response that opposes an action is known as a negative feedback loop. So that's an important term to know, negative feedback loop. Okay, we're going to wrap up our session today and talk about what I always found important as a student. When are things due? I always first thing wanted to go to the syllabus and see, okay, what exactly do I have to do for this class and when is it due, so I could write it all down and know and understand what the expectations were. So your due dates are the same for every week except for week 10, and we'll talk about week 10 when we get closer to week 10. So generally speaking, you're going to have 3 things due each week: a quiz and an assignment and some discussion postings. Your discussion postings, your initial posting, which is your first posting of the week, should be done by Wednesday. And then you should focus the rest of the week on replying to other people's postings or questions I might pose to you. So in total, you should have your initial posting and at least 2 replies each week. Good quality postings. Use a reference source to support your findings and list your reference source. Make it all your own words. No copying and pasting. Your assignment and your quiz are due by Sunday, as well as those replies to the discussion. So everything is finally due by Sunday of each week. The only exception to that, again, is week 10, but I will give you a heads up on week 10 when we get closer to that. Let's end with some friendly reminders, some keys to success. I've done this long enough where I've seen what works for students and what doesn't work, and I want you all to be set off on the right foot. I want you all to be very successful. So definitely take this knowledge and really put it into play. The green guy with the question mark, ask questions. Nothing is off limits in terms of how big the question is or how little you may feel it is. Shoot me a question whenever it pops in your brain. You have my email address, just email it to me. That's the easiest and quickest way to get a hold of me. If I ask you a question back, reply. The clock, time management's important. We don't meet in a classroom at a certain time, so I'm going to really depend on you guys logging in every day and doing work, not just logging in, but doing work. In fact, attendance in the online room, you don't get attendance for just logging in. Your attendance is tracked by you posting something meaningful to the discussion, submitting an assignment, or submitting a quiz. Those are the ways you post attendance. So make sure that you are participating throughout the week. Have fun. That's important. These classes should be of interest to you. This is your future career that we're gearing you up and getting you ready for. So this should be fun, interesting information to you. Set goals. Don't just go all willy-nilly and see what happens. Set goals of what you want to achieve each week, the grade you want to get in the class, everything and anything. Goals are important. Write them down. Hold yourself accountable. The sponge to me is very important. You pay good money to come to college. This is a choice. This isn't a have to. This is something you've chosen. Gain all the knowledge you can. Soak it up like a sponge. Get your money's worth out of every class you take. On the don't side, one big don't is that empty seat. You have to participate. The class will not do itself. You're not going to pass if you're not doing the weekly requirements and doing them on time. So please make sure you are being active each and every single week. If you have questions, again, don't hesitate to ask. You're not in this journey by yourself. You totally have me on your side to help you throughout the way. So, use my knowledge to help you. Our textbook for this class will be the same for all 10 weeks. This is the book that you will need. It's where I will pull the information for our presentations from each week. Definitely, if you haven't already done so, do order that. I appreciate your time today. If you have questions, definitely shoot them to me via email. Thank you, and here's to a great 10 weeks.